Well, today we are taking a closer look at how colleges handle mental health on campus. New reporting from the Washington Post chronicles the complicated process of taking medical leave.
Some universities require students to reapply. Yes, reapply after taking time off, which could mean submitting an essay, securing references, or sitting down for an interview. Licensed therapist Dr. George James joins us now. Thanks so much for joining us, first off. Talk to us about how students can tell when things are starting to get bad enough to take a break, and should they be considering the academic implications of their decision?
Overall, it can be really tough for students in college, sometimes being overwhelmed with their mental health in terms of anxiety and depression. And some of the things that students need to think about, if they get to the place where they're unable to function academically, if they find themselves where they are overwhelmed and not even able to engage socially, these are things that might allow them to think about taking a break from school. Sometimes they might be falling behind on their studies more than they are used to, or even get to the place where they're thinking about thoughts of self-harm or suicide. These are things that might say, I might need to take some time off from school.
Dr. James, really good advice there. What about colleges? What's their role in all of this? Because as Kathy just mentioned, there are sometimes really difficult policies, hurdles for students to kind of climb over if they're trying to get back in. So it can be intimidating to take yourself out if you're already struggling, thinking, man, it's going to be so hard to rejoin my classmates.
Yeah, Vicki, I think that the colleges can do a much better job of making the process easier for students. Sometimes it is necessary to take the break, but it shouldn't be something that is harmful or traumatic to the students. Some universities could do a better job of making it a one-stop shop, or maybe not even the reapplying or the reapplication process. Maybe there's a way to make sure that the student can come back, but that they are supported and get the necessary treatment that they need. Because some of these universities, I think, are making it much harder than it probably needs to be for the students.
So, if it gets to the point where students do need to take that medical leave, how can they make the most of their time away from school?
The biggest thing that students really need to think about is that they need to start or continue treatment with the mental health provider. What that is saying is that they might be at a place where they need skills, they need tools, they need resources, they need ways to deal with whatever might be going on with them. Sometimes they're actually dealing with some things that are very harmful and traumatic that happen to them. So they need to go through that process. They also might need to think about talking to their loved ones of how they can be supported, allowing maybe a little bit more people to be in on what's going on with them so that they don't feel isolated and alone during this process.
Dr. James, are there certain strategies or techniques when you go back in and return to campus, reintegrate yourself? Maybe should you take a lower course load? What are some strategies to be successful when you go back?
Just like anything, when we're starting something up again, we might want to make sure that we engage all the people that might be helpful. So one, you want to make sure that they're continuing treatment and still involved with care. Two, they might want to think about a reduced course load because that can help them make the adjustments that they need. The other part is to speak to your professors, advisors, that sometimes, once again, students try to keep themselves isolated, but this is a really good time to make everyone know what's going on and why you're there. You don't have to give the full story, but you can update them so they can support you.
Really valuable advice, as always. Dr. George James, great to see you. Thank you so much for your time.